Welcome to Trustin Podcast. Today we have Dr. Rahul, orthopedic surgeon at Trustin Hospital. We are here to discuss with the most important challenging surgeries in the orthopedic field, that is joint replacement surgery. Doctor, in the let me ask from the basics, what is joint replacement surgery?
So when we talk about the joint replacement surgery, it is most commonly the hip and the knee joint replacement surgeries that are commonly done. So basically, what in joint replacement surgery, what we do is that we take out the damaged or the degenerated part of the joint and we replace it with the prosthesis. So when we tell about the prosthesis, it can be with the metal components and also polyethylene liners. So these are the most commonly done surgeries.
Doctor, when should someone look for the joint replacement surgery? Is there any warning signs or symptoms that will that will lead to the joint replacement surgery?
Yeah. So, joint replacement surgeries are mainly advised for the patients who are suffering from end stage degenerative arthritis, or commonly called as the osteoarthritis. So, usually the patient will present with a significant joint pains that doesn't go away with any kind of a conservative approach. So, either it can be with medications or physiotherapy. Your pain doesn't go away. Definitely a red flag sign to consider. The other reasons can be even a significant stiffness in the joint, or even mobility is reduced to an extent where a patient is not able to walk for a short distance, or even carry out a small activities like climbing the stairs or even gardening. So such things become difficult, then patient should think of a joint replacement surgery.
By the surgery, how the patients are getting benefited?
Yeah, see, the joint replacement surgery, one important benefit is the consistent and constant pain relief that the patient can expect after the joint replacement surgery.
Doctor, usually people ask for the risk factors. So how is it safe to proceed with the surgery?
So when we talk about the safety of the joint replacement surgeries, have as we know that these are the most commonly done surgeries in the orthopedic procedures. See, the now with the advancing techniques and technology, and even better understanding of joint kinematics, and even the availability of better implants, or the better design of the implants, so we are able to recreate the normal anatomy of the joint and even the biomechanics of the joint. Definitely is the safest surgery. And based on the risk, definitely you should consider in a young age, or when you have a good muscle strength, or even you should consider your BMI before undergoing the surgery.
Thank you for sharing these kind of information, doctor. I hope really it is helpful for every patients and the viewers who is watching. Thank you, doctor.